Namaste, and welcome to our continuing series, Interviews with Disciples and Devotees. I have been away for a year and a half, and this is the renewal of our series and many more to come. Today, it is a great honor for me to introduce you to Dr. Vikram. Namaste.
Namaste.
And we'd like to ask you first to tell us a little bit about your life and training, and then we could get into how you found Mother and Sri Aurobindo. I know that you are a doctor of sports medicine, and maybe you can tell us about your studies prior to that and continuing.
So, my story begins where everybody else's stories begin, which is with birth. I was born in New Delhi, and through the play of circumstances, I ended up being raised by my grandparents primarily, since the age of 4 months onwards. The early childhood, my memories included going to satsang with my grandfather, and that had a very deep impact on my psyche and the way I enjoyed the company of satsang, a company of those who, of the holy, the people like-minded, and then people who were focusing on the play of the divine through life. So those were my early childhood experiences. I was born with reasonably decent amount of wealth in the family, which dwindled over a period of time, and ended up the family ended up becoming very poor and poverty-stricken, and to the point that we were living in a hut made out of clay. And
in New Delhi?
No, at that time we had moved to Nainital area. Yep, and could not afford the schooling, so I was not going to any school either. So I was essentially a boy running around in the streets of India, streets of Uttarakhand, present-day Uttarakhand. Back then it was UP. And beautiful area. Some of the most beautiful memories of my life come from my childhood in that area, just sitting in streams of water, walking through the jungles, making friends with monkeys, that they would come sit on my shoulder, and communicating with nature. So that impact in my early childhood with satsang earlier on, and then later on spending time in the jungles, just never left me in my entire life. So there was a piece that was missing. Then we moved to New Delhi, and I was still not going to school for the most part. And at the age of 14, I migrated to the United States, and that's pretty much the first time that I started going to school, I can say.
You went with your grandparents?
I went with my father at that time. In United States, at the age of 14, they enrolled me into the public school system over there, which was phenomenal because that was the first time in my life that a teacher actually ever paid attention to me and took me under her wings. There's a particular teacher that I'm thinking about, my mathematics teacher. And since that time, I became very interested in mathematics, physics, and they had initially put me in English as a second language class because I didn't know any English. I didn't speak a word of English at that time. And subsequently, I ended up excelling in all the subjects by the time I graduated from high school. I received admission to a nice college, but about one semester into the college decided that this is not for me, this education, and I wanted to enjoy life a little bit more, so I joined the US Navy. And I spent 5 years active duty in the Navy and learned a lot about the military, the way of life and structure and discipline, but decided that without good education, this is not a proper life for me either. So after 5 years, I left the Navy and I went back to undergraduate studies. So I completed my undergraduate degree in biology in pre-medical sciences in California and received admission to a medical school. In between the degree, the undergraduate and the medical school, I had 2 years gap. So this is 2004, and I started medical school 2006, and those 2 years I enjoyed life. I went back to my little childhood, and I worked hard, and I just did all sorts of things that I wanted to do. I started exploring spirituality more. I went to many different religious groups and organizations, including churches and temples, and traveled outside the country, and started meditating.
You mentioned that you went to the Seventh-day Adventist.
Yes. I went to a Seventh-day Adventist church in San Diego, and I was a frequent over there. To the point that they at one point in time even talked about baptizing me as a Seventh-day Adventist. But something in me just felt that that was not for me. I was still looking for some answers, something from my childhood, that I wanted to follow, a story that had not been completed. So I kept doing that, not finding any answers. I started medical school, just something on the side, something to do with life, because enough people in my family were telling me that I have to do something in life.
But in that 2-year gap, did you travel also?
I did, yes, mainly to Mexico, because I was living in San Diego for the most part, so I would go to Mexico. I went to Mexico a few times, sometimes deep within Mexico, driving and other things. So had a great time integrating with Mexican people. I learned a fair amount of Spanish, enough to communicate on my own and travel comfortably, in the Latin American world, which helped me later on in my medical career with the patients who did not speak English. So fast forward into 2006, I was to start with medical school. I decided to take one trip to India, and that was my first trip to India since moving to the United States. During that trip, I had basically one goal during that trip was to find my mother, whom I had not been in contact with since the age of 4 months. So I was not aware whether she is alive, whether she is not, but I wanted to find her, and I did find her, literally one day before I was supposed to leave for United States. And since that time, I have been in touch with my mother, and our relationship has developed further as a mother and child. And that part of life has been beautiful, reintegrating with the family life. So in parallel, the medical school was taking place, and I was also meditating a fair bit. And I had some what I consider to be profound meditative experiences, to the point that it disrupted my harmony in life with my studies and my spiritual side of things, and I was not able to focus on my studies, and I did not have a guru at that time. So I discontinued the meditation for the most part, just so I can focus on my studies primarily. And
And you got your doctorate in
regular doctorate of osteopathic medicine. So I went to a DO school. In the United States, there are two different kind of pathways one can pursue based on the philosophy. And DO is a more holistic side of medicine, and MD is the more classic allopathic side of medicine. So as far as the licensing is concerned, both have parallel privileges in terms of unrestricted license to practice medicine and surgery. But philosophically, DOs and MDs vary. And so I continued with medical school, and around 2008, 2 years into medical school, on the internet, someone mentioned the name Auroville, and it got stuck immediately. It got stuck in my head. And I decided I must go visit that place. And finally, I made a trip to India in 2010, where I visited Auroville, not knowing any difference between the Auroville and the ashram. And at that point, I knew that this was my place. That
you didn't know about Sri Aurobindo.
when I came to Auroville, I came to learn about Sri Aurobindo and the mother, and just absolutely their philosophy resonated with me. And during that time, I was in my final year of medical school. I wanted to not even finish medical school, or finish medical school and not pursue further medical training, and just move to Auroville and live the rest of my life. That's how strongly I felt about Auroville. However, there was a woman in the situation. So my present wife, we had been dating at that time for about 2 years, and I wanted to pursue a family life. I decided not to go with Auroville and stay the course with finishing the medical school. Subsequently, got extremely busy. If anybody knows anything about the medical training post-medical school, is very difficult work, hundreds of hours a week, sometimes 80 to 100 hours, sometimes 60 hours a week. So very busy time. So you forget about everything else except just being in the hospital, being on calls, and that kind of life. That went on until about 2015, when I finished my postgraduate training. Initially the intern year, then the residency, then the sports medicine fellowship, which in the United States, the sports medicine focuses on treating the athletes, and bulk of which is orthopedics in nature. So my primary training was in physical medicine and rehabilitation, where the idea is to treat all sorts of injuries, including brain injuries and strokes and other things. So with subspecialization in sports medicine, I decided to take on my first employment in California, and because that's where I had done my undergrad, and there was a piece of my heart that was left in California, I wanted to move back there. And the first job kept me very busy with life. So during that time, I was not studying Sri Aurobindo or the mother. And in 2017, we had our child, and the world changed. As I became a parent, I started thinking about the best possible upbringing for my child. And in 2010, I had picked up a DVD titled Introduction to Integral Education by Shraddhalu Ranadeji. And that sat on my bookshelf, and I had never looked at it until 2017. And I played that DVD, and that was my introduction to the world of Sri Aurobindo and the mother. And since that point forward, I have not looked back at all, and I've been studying more and more, and have become a devotee of sorts of Sri Aurobindo and the mother. And if I were to put it metaphorically, the journey of life has become from light to greater light from that point forward. So in the last 4 years. And I've been seeking greater and greater interaction with the Sri Aurobindos centers and communities around the world. And
you went to some of the centers in America?
yes, in California, close to where we live, and there is a Sri Aurobindo Sadhana Pitam in Lodi, where I've been going for several years. And at this stage, my main focus in life is to find the best possible upbringing for our two children.
Do you think at all about the children going to school in the ashram?
Yes, I would.
And if you moved here, where would you prefer to live first, in Auroville or the ashram?
Since I have always enjoyed country living and being in open spaces, I physically enjoy the living in Auroville. However, I have also enjoyed the intellectual side of things, and as far as schooling is concerned, I would definitely would like to be considered for schooling of my children in the ashram school, and where I can also continue with my studies of Sri Aurobindo and the mother.
Now, we are in this strange period of the COVID time. Could you speak a little about that as a doctor?
So, COVID has brought the world to a halt in many aspects of life, including medicine. And there are more questions about COVID that remain unanswered for me than the answers that I have. And the science on that that I have looked into personally has not provided me with answers to my satisfaction to make the decisions that I would like to make. And it seems like a very difficult situation all the way around, what choices one should make. And it has become increasingly difficult for me to advise patient one way or another, just based on good conscience. I can obviously follow the mainstream narrative and just, like a parrot, just repeat what I'm being told by the higher medical society, but I don't feel right about that.
Could I ask some specific questions, such as whether or not you feel that masks are useful or lockdowns?
Well, the way I think about it is, if masks actually worked, then we would not have needed the social distancing type of measures. If those social distancing measures actually worked, then we would not have needed lockdowns. If lockdowns were actually beneficial, then we would not have needed the vaccines. And if the vaccines were beneficial, then this would have been over. So, there are many, like I said, there are more questions that I have than answers that we receive. And as with many things in life, it is not always plausible to just follow the mainstream narrative, because I have many answers, but those answers do not always satisfy me. So if you ask the question about the masks, the general understanding is that the pores inside the masks are much bigger than the virus. So the virus should be coming out in every direction, maybe to the sides, even if you're able to block it in the front, and then it'll land on places. And in my personal opinion, should not necessarily reduce the transmissibility of any viral particles, unless you're using N95 or other higher grade, medical grade respirator type masks that we use with TB patients and other situations. So just simply wearing a small face covering, I do not see much utility of that.
Could we talk for a bit about your experiences this time in Auroville and in the ashram? People perhaps that you've met and spoken with.
So this particular visit to India for me has been with very different agenda during these COVID times. I wanted to find some answers, but I didn't want to look for the answers in the most traditional ways by reading more and more journals and articles and news pieces. Instead, I decided to take on to the spirituality of things, and with that intent, I came to the ashram and the Auroville, and it seems that ashram has decided to follow the mainstream narrative with lockdown measures and everything else that goes along with it. And my recollection of Sri Aurobindo is that he himself has spoken against some of these things, including vaccinations, as being based on rather dark principles. So, with that background, and as a doctor not taking either side, being as neutral as I can be, I would like to see a more healthier discussion, discussing both sides, and taking more of a neutral stance as a ashram, for the ashram community, which does not seem to be the case.
Who did you meet in Auroville that impressed you in the gardens of Matrimonial or in other places in Auroville?
So there is a gentleman that I met by name Rajan, who to me seems to have a very genuine and kind-hearted and pure soul, from which he is connecting with Sri Aurobindo and the mother, and he has created a museum of sorts where he's collected the darshan messages from the mother and Sri Aurobindo over the years, over the decades, and in his simple way, that seems to me a lot more profound than setting big societies and libraries and big things, And I feel it is these individuals with this deep faith and desire and longing to connect with the teachings, the energy of Sri Aurobindo and the mother, that appears to hold more of a truth in following their teachings and then just big bureaucracy.
How much have you read of Sri Aurobindo and Mother?
Not much. Not enough to consider myself a disciple. I would still consider myself a devotee. And interestingly, having a very strong intellectual background with the left brain being dominant, in my ego state, figured that I can dissect and decipher and cut through Sri Aurobindo's teachings, and those attempts failed miserably when I did that. And it was not until I unplugged from what I was reading and absorbed the essence of it that I was able to feel the beauty and experience the beauty of those writings. So in general, I would not consider myself to be well read on Sri Aurobindo and the mother.
But you did tell me, I think once, that you found reading the mother easier.
Absolutely. Yes. Yeah, I would say so. Yes. She helps me understand Sri Aurobindo who appears to me at a different grade of consciousness that I'm able to access. Yeah.
Very good. Tell us a little bit about your wife. Is she interested at all in spirituality?
She is, and she went to medical school with me. We met in medical school the second year.
You told me that she's a psychiatrist?
Yes, yes. So I can see when that turn took in her life to wanting to pursue the mental health field and really delve into the psychology of things and why people do what they do and why they behave in a way that they do. But the system is set up such that one is kind of forced as a physician to prescribe drugs and treat things in a more crude way than to take the time in understanding what the situation is. And that's pretty much the so-called Western practice of medicine, Western way to approach things. But I would say she's definitely interested in more of integrative way of looking at things over the period of time as we have grown with the Sri Aurobindo Society.
Where is she from?
She was born in the United States, grew up in the United States, but the family comes from India. Yeah.
When you go back, you will go back with a lot more understanding and knowledge.
That's the intent.
Of people. Perhaps you could talk a bit about Shraddhalu.
So, Shraddhaluji, I would consider him to have had the most impact on my understanding of Sri Aurobindo and the mother. In fact, I would consider him to be my entry into the world of Sri Aurobindo and the mother. And along with that, the integral approach to education, thinking of children as a spark of the divine and our role as parents and the primary teachers in the early stages of life to help nurture the seed of light that we call children into becoming whatever they are to manifest. You know, if there's a seed of orange, they will become orange. If there's seed of apple, they'll become apple. So it is to bring about that spark of that soul within into the child. So with that mentality, the approach to education would be very different. The child is not meant to be beaten into certain kind of a product to serve the industry the way it is done in our society presently. The child is there to manifest and realize the direction of their soul and enjoy life in that perspective. So with that intent, I am seeking the best possible way to educate my children, you know. Unfortunately, most commonly what happens in the world these days, it seems to me, is that instead of educating, instead of giving opportunities, we tend to train our children into becoming yet another cog in the machinery, you know, to fill a job, you know, to fill a role. And the discussions that even the career counselors give us usually revolve around, oh, there is good potential in this field is going to become big, as if the purpose of life is to go serve in a certain sector of life, which doesn't seem to be the most reasonable thing to me. And then coming back to Shraddhaluji, his lectures on education and upbringing the children from the days when he was a teacher himself at the ashram school, and his insights into the way of education seem very profound to me.
How do you find the education in America versus that in India, in systems?
So it would be difficult for me to speak about the education in India, because when I was young and in India, I found the education to be really horrible. In fact, even when I went to the school, there was not much education taking place, and that was in the government school. Perhaps private schools are different, but I did not go to one, so I wouldn't know. There were brief periods of my life where I went to a private school, and my recollection of that was that the more they approached the Western style of teaching, the more they were acclaimed as schools in India. So I have not attended any school in India, nor have experience with any school in India, where the methodology of teaching is more in alignment with the native way of life in India. It seems like it's been westernized, and the children are being trained to serve the Western world. As you can see with the call centers, people learning American accent, just so they can work for a multinational company and those kind of influences. So I can't speak much to the different ways of education in the Indian system. This is just my basic understanding of things. Yeah, perhaps there are schools that are trying to maintain certain elements of what is innate to the Indian culture, this region. And perhaps some schools take this too far in the religious grounds, I don't think that is a good idea either, because as Sri Aurobindo has mentioned, that our future lies not in the dawns of yesterday, but in the noons of tomorrow. So we have to take the best of both worlds, East and the West, and derive the future from that. So that brings me to discuss a little bit about the Western approach of education, which I find to be quite amazing in a sense that they're pursuing the left side of the brain, the intellectuality, to its limits, very much. So when you look at the premier institutions like MIT and Harvard, and I'm a science person, so I like physics and those kind of things. So those disciplines in the United States are explored to their extreme. But that extreme does lead to a reductionist view of life. Meaning that there is no existence of spirituality, so there is something very enjoyable about that view of life. However, if you completely remove the spirituality aspect from that education, it is missing one huge part of what forms everything. So it is not until we combine the two, and not looking into the past so much as to going into the past or living in the past, from combining the two and deriving our future, that we will be able to solve some of the issues that currently face the world. There's an old Native American saying that I remember, which I would paraphrase as, it is combining the past with the present that you derive the future.
What do you find in your searching? And you have searched a lot. You've searched various religions, different faiths. You mentioned once Rudolf Steiner. Could you speak a little about your experience there?
So I would consider Rudolf Steiner to be a vibhuti, similar to Nikola Tesla. And again, have not had the opportunity to study Rudolf Steiner much, because of the busyness of life, studying medicine and then having children. But what I do know of Rudolf Steiner and his writings in so many domains of biodynamic farming, to the schooling system, the Waldorf schooling system, and the approach to upbringing the children, I am profoundly moved by Rudolf Steiner's work and his contribution to humanity.
What do you envision for the next 10 years of your life and your family?
I envision my personal spiritual growth, at the same time with that growth, the growth of my family. In terms of upbringing of the children, which seems to be the main focus for me in life, because the children that we're bringing up today are going to be the future of the world, and perhaps the future leaders of the world. But on a personal level, I do not want to leave it to my children to burden the battles of the future. I want to personally take on as much as I can while I'm going through my own journey, so that I leave my children with the best possible circumstances for them to carry on this future direction.
You mentioned that if you came permanently to India, you would help in the ashram.
That's the intent.
As a doctor, can you enlarge upon that?
Yeah, so over the last few years, I have become very interested in what in the United States is known as regenerative medicine, which differs from the conventional methodology that when you have an injury, in the regenerative world, the intention is to figure out ways to best heal that injury permanently and positively, rather than mitigating the symptoms just so the person can get back into their way of life, only for that problem to resurface again. So it's a very different mindset, and I have pursued quite a bit of training in regenerative procedures, and at the same time, I have started to look into vitamins and supplements as ways to enhance and promote the healing process in the body. So I believe when one changes the intention of how they're treating the patient and what the end goal is supposed to be, the outcomes start to be different. And for example, I've had one patient comes to mind who's in his early 70s, and he went to go see the orthopedic surgeon, who said you should get a knee replacement done as soon as possible because of your age and the arthritis in your knee. I decided to do prolotherapy injections on his knee, which promote healing and regeneration of certain tissues, mainly enhancing the strength of the ligaments, although it will not reverse the arthritis per se, but it makes the ligaments that hold the knee together stronger. And when I did that procedure on this individual 3 times, his function improved to the point that he was no more symptomatic. His knee was not buckling as much, and he was able to go for about 9 months to a year doing pretty good with his knee pain and knee functionality, and did not have any falls, and he was able to experience better stability of his knee. And this was all done in a natural way without further deteriorating his knee, which would have been the case ordinarily if I had injected steroids into his knee. It would have progressed him along towards the path of getting a surgery. So more recently, we started doing another procedure which is further enhanced than prolotherapy injections. It is called PRP, which stands for platelet-rich plasma, which is derived from a person's own blood, centrifuging it, spinning it in a method to extract the growth factors, the platelet-rich portion of it, and then injecting those growth factors into the target area. Usually under imaging guidance. In this case, it was ultrasound guidance. So the same patient came back to me, 71, 72 years old, and said, the last one worked for me, but I'm looking for something even better. So before coming to India during this trip, I treated him twice with this PRP procedure, and he was doing extremely well. He did not feel that he would be needing knee replacement anytime soon. And it is in patient's words that if this continues in this direction, he may never need knee replacement in his life. That's how the patient told me that he feels about the stability that he's gaining from this procedure. So although the arthritis per se is not able to be reversed, the disease has progressed to the point, there are other things that one can do to stabilize a damaged joint that gives a person the function that they're seeking, the level of function for his age, which allows them to live a comfortable life. So that has become a big focus for me. A lot of regenerative procedures of different kinds in different parts of the bodies. And with that background, if I move to India, my intention would be to offer some of these services to the athletic departments, the children and the adults even who are engaged in sports or not, just living a normal life, people who enjoy being active, who actually have an intention to heal their body, who are doing things in terms of eating good diet and supplementing with things that their diet is deficient in. But I generally like to help the people who have at the very least formed an intention to want to help themselves. If somebody is seeking just a quick fix, then that's what I give them, because every person has the right to choose the kind of medicine that they want to, the extent of treatment that they want to. So I'm not here to push anything upon anyone, but I want to offer the best possible medicine that I can offer to these individuals.
What are the negatives about knee replacements? I've had a neighbor and a friend who had both knees replaced, and one didn't work and had to be replaced again. And I've seen that happen quite often.
So, strictly looking at the statistics, knee replacement, according to our statistics, is considered quite a successful procedure. So, most individuals who get the knee replaced end up doing fairly well for their level of function. Now, there are always going to be patients who don't do as well, and I have personally seen many patients with many different failed surgeries. I don't mean to sidetrack, but spine surgeries particularly do not provide very good outcomes long term. Patients might benefit from spine surgeries short term. However, in the case of knee replacement, generally people on the whole end up doing better. But there are always complications, as with any surgical procedure. Sometimes the implant doesn't take. Sometimes the bone underneath is not able to hold on to the implant. Sometimes the implant disintegrates somewhat. There's a plastic component to it that can disintegrate. Some of the metal filings can disintegrate and go into the bloodstream and cause downstream damage, most of which we don't even bother to study the ill effects of that, because in the world of surgery, typical follow-up is about 6 months when we're looking at outcomes. And perhaps that's the reason why these surgeries are considered rather successful, because they're following patients short term. So since we don't look at long-term outcomes of these things, we really don't know the true implications of these surgical procedures. But since I am not a surgeon, in my non-surgical opinion, it is always better to avoid the surgery in the first place, because then you have a 100% chance of avoiding complications if you don't have the surgery.
I'm interested in what you said about the spine. Are there natural procedures that are helping patients with spinal injuries?
So, spinal injury would be, again, a broad term. If you ask a doctor, they would want to know exactly which spinal injury are we talking about. Are we talking about spinal cord injury? Are we talking about disc injuries and other things? So, considering garden variety low back pain, which happens either due to a disc situation or the facets, which are the smaller joints in the back portion of the spine, and those start off with undergoing degenerative changes, meaning they start degrading. So the spine does not hold its position very well, and it is not as strong. So as it loses its strength, then you start to have problems. A disc gets ruptured on one side, cause a nerve pain down the leg, or the facets become very painful and a person loses a significant amount of their mobility. And when you look at the pathophysiology of how these conditions come about, it is always better to focus on prevention and change the culture, so that way we live a lifestyle where we are not injuring our backs in the first place. Because once the lower back is injured, to change the direction into healing and then again stabilization, most patients have difficult time finding the will and the desire to do that. Most of my patients, in my experience, are simply looking for pain relief, and then they go down the road of pain management, which in my personal opinion is a horrible way to pursue healing, because that's just managing your symptoms. And they will go on to get surgeries, and literature shows long-term lower back surgeries done for pain management purposes on the whole do not work very well. They provide short-term relief, but the symptoms more often than not invariably come back, usually with vengeance. And people end up in this vicious cycle of pain management, medications, injections, and then surgery again. And overall, their quality of life deteriorates. So it is better to maintain the conditioning of your back by remaining active, doing stretches, yoga, tai chi, qigong, meditation, mindfulness. Those are the things that would allow one to maintain a good connection between their mind, body, and, shall I say, spirit, which is a dirty word in the Western medicine. Yes, spirit. Because of the reductionist thinking, there is no existence of spirit in Western medicine.
And what about physics? Can you speak to us a little bit about that? I know we're running a bit late.
Physics.
We could get 5 minutes more from you, and maybe continue this another day. That would be wonderful.
In what aspect? In
the aspect of the spirit or the soul.
So, there have been some discussions I've had with Shadhaluji about physics. He's very much interested in physics, amongst many other things that he's interested in. And it is my opinion that the conventional physics is missing a huge component of life force and life energy, which is, if you look at the older physics, pre-Newton time, was referred to as the ether. And if you remove that from the physics, you end up with a mechanical version of a physics that works in a very particular construct, but it doesn't work in a cosmic sense. And again, it goes into the reductionist way of looking at things. And if you take, for example, the speed of light, known as c, the constant, it is described in vacuum. There is no place in the universe that I know of where actually complete vacuum exists. So this condition does not exist anywhere. But to reduce that, just so the equations work, they will use the speed of light in a vacuum. That's just one example amongst many others. There are examples with gravity being a relative thing, and the gravitational forces are always present, and we don't always take into account what gives birth to gravity, and the energy that is held in the space, empty space. What the science called empty space is actually the space that holds 99.99999 many orders of magnitude of energy. So they have conveniently decided to normalize the equations by removing the vacuum density from the equations, just so the equations work. So what that effectively does is it puts blindfolds on the way we look at the universe, the way we look at the world, the way we look at energy. The universe is teeming with energy. There's no reason for us to be dependent on fossil fuels or other dirty ways of gaining energy. But in a reductionist way, that's all we are left with. Because we have decided, as far as the science is concerned, to do away with the majority of the force that exists in the universe that animates everything. So that's my brief mention of physics.
But Mother said that all the energy you need is you can get from the sun. And Sri Aurobindo tells us that the sun is only a reflection of that.
Yes.
Which is forever.
Yes. Yes.
So there's a lot of progress necessary. Are there any, should I say, real thinkers in any of these fields? Deep thinkers in physics and medicine and astronomy and...
Yes. Yes. I would say so. Many of these thinkers are ostracized for their way of thinking. I will not take names because I do not want to bring, inaccurately speak as to these individuals. But for example, in my own case of regenerative medicine, by the mainstream folks, it is considered quackery. Because, for example, prolotherapy, I often get told by folks that you're giving people placebo, and this is a placebo effect, and people are being healed. And my answer is, even if that were the case, if it is a placebo, because I do not claim to know everything and the mechanism of everything, even if that is placebo, at least it is not harmful to that, and they are being healed. So even if that is the case, it is better than the alternative of doing something that is harmful to their body, such as injecting steroids or giving them non-steroidal medications for these chronic conditions. There's always utility of every kind of medicine. There are times when you would want to inject steroid. There are times when you would want to treat with non-steroidals. But as a doctor, one should be very judicious about when to use what, rather than applying a cookbook approach to medicine, which seems to be the case most frequently these days.
I wish we had more time, but we've used up our time for today. Dr. Vikram, thank you so much.
Okay, it's a pleasure.